We're going to first finish up nervous system problem set. Finished up to question 62 last time. And we're going to start with question number 63. What I would like everyone here, if you raise your hands, I will, call on you so you could read the question. You could give me, what you believe is a correct answer and your rationale. Even if it's not correct, if you're participating, I take a note of that, right? The goal is not that you give me all the correct, that you participate and, state your choice and the rationale why. And I look at the participation, who participates. So I already have an idea who are the regulars are here. So who participates. So raise your hands in the Zoom chat. I will call on you. We'll start with number 63. See, Ian has his hands up. So Ian, if you would like to start with number 63.
All right. The sodium-potassium ion exchange pump actively transports 3 extracellular sodium ions for 2 intracellular potassium ions.
Okay, so E says it's E, right? Does anyone disagree? Or everyone agrees?
I think it's D, as in dog.
Edwin, you say it's D?
Yes.
Yes. So Edwin, you're correct, but can you explain why?
I believe the sodium potassium it pumps out 3 sodium. 3 sodium rushes in, if I'm not mistaken. No.
2 potassium out. That's right.
Yeah, okay, so, and 2 potassium out to make the inside of the cell negatively charged.
Yes. So Edwin, you're correct. So the correct answer is D. I'm just going to show you, right? So you guys understand. Well, imagine this is the cell, and we're gonna say these purple channels, they were bringing in from the outside. Sodium was rushing in.
They can't hear us.
Right?
I'm muted.
The sodium was rushing in.
So why wouldn't that be extracellular sodium? Because that's where I made my. I know sodium comes in and potassium goes out. So maybe I just mixed up my word.
Yeah. So let me finish explaining it so you can understand. And then if you have any questions, you can ask further. Initially, right, we said there's a sodium that was coming in that was causing depolarization. So accumulation of the sodium, and I'm going to draw a different color. This was green, and potassium was leaving, right? So we have potassium that was escaping the cell and sodium that was coming to depolarize. As by which you notice, right, the accumulation of sodium in the cell is going to increase. Let me use a different color. So accumulation of the inside the cell is going to increase, right? And potassium is going to escape the extracellular level of potassium go high. So K plus is going to be on the outside. But for us to return to the normal rest, the cell, right, has to equilibrate and return to the resting potential. So on the cell surface, there are these receptors. They are sodium potassium. So they're sodium potassium ATPases. And the reason why they call ATPases is because they employ ATP as an energy source in order to drive that pump. And what it does is this sodium potassium ATPase move, right, 3 sodium out, and it will bring back 2 potassium. So it will throw out sodium cations, and it will bring back 2 potassium inside, right? So it's asking what is actively its transport. Actively means active transport is utilization of ATP. That's why it's called sodium potassium ATPase, right? And its function is to take 3 intracellular sodium for 2 extracellular potassium to restore the gradient. So usually, yes, the cells are bags of potassium in a sea of sodium, but when depolarization is occurring, we have rushing in and potassium rushing out. For the cell to restore the resting state, right, negative 70 millivolts, these sodium ATPases have to utilize ATP in that gradient. How do they do that? They take 3 intracellular sodium ions that were accumulated, right, with this process, and they replaced them with 2 potassium ions that were now excreted, I should say, effluxed outside the cell. And restoration of these ions, now we have restoration of resting membrane potential, right? That makes sense to you, or you still wanted to?
I would just want to know, so the key word in that question is actively.
That is correct, because the moment you have active transport, you're employing energy, right? ATP or GTP. You want to employ energy now. So we're moving cations against the concentration gradients. Why? Because if the cells, right, if the cells are bags of potassium and the CF sodium, and this sodium potassium ATPase is actively pumping out 3 sodium out, right? And so the surrounding environment, there is a lot of sodium still here. So it's going again, it's going, right? It's not a diffusion where it's going with the concentration gradient. It's going against the concentration gradient. So when you go against the concentration gradient, you must employ. So yeah, active is the key word, employing ATP, and it's 3 intracellular sodium ions, but 2 extracellular potassium ions in order to restore the resting state.
Just one more question, Nick. In order for E to be right, how would the question read?
3 extracellular sodium for 2 intracellular potassium. The thing is, potassium doesn't do that. So if it did that, it will bring sodium inside and potassium out. And sodium potassium ATPase does not perform that. The action of sodium potassium ATPase is usually, for most cells, is to get rid of sodium that's accumulated inside the cell and bring back inside to restore the resting state of the cell.
Thank you.
Yeah. Okay. So any other questions on number 63? That's actually one of important questions to understand the sodium potassium ATPase, the pump. Right. We're going to go to no questions. We're going to go to number 64. Who would like to do it? If you raise your hands, I have Hyra do 64.
It's Hero, by the way. Just let you know.
Sorry, here.
It's okay. The resting membrane potential exists mainly due to passive leak channels.
Leak channels, A is correct. Correct. Yeah, the resting membrane potential exists mainly due to the passive channels. So once equilibrated, right, we have leaky channels. I think in the nervous lecture when we had the touch sensitive receptors, right? So they leaky channels and they restore that. So 64. All right, number 65. Larry. Larry, would you like to go?
The equilibrium potential for potassium ions occurs at approximately, I believe, negative 70 millivolts.
So 65, right? So remember, careful.
Isn't it not
so
negative?
It doesn't say. So the question doesn't say threshold potential. The question says potential. The potassium or the K plus. Let me see if this will if I have this chart here. Yeah, here we go. This was the chart, remember? So we were looking at potassium, right? So this is the potassium. So the equilibrium potential is here. So, right? Why is this equilibrium potential important? Is when those channels are open, right? And gated channels are able to basically exchange potassium. Potassium wants to reach its equilibrium potential, which in this case would be negative 88 millivolts, right? That's essentially when the cell is going, right? There is efflux of potassium ions, right, from the cell and wants to become negative. But before getting to that equilibrium potential, those channels will close. So remember to look at the words carefully. So equilibrium versus threshold. So let me go back to that. So we see here that for potassium, it's minus 88, right? Let me go back to that question. So if you make your now after seeing the chart, what would you say? Would you still stick with negative 70 millivolts?
Minus 90.
BA.
Yeah, minus 90 millivolts is correct, because true about minus 88 millivolts, the equilibrium potential, but minus 90 is the closest to this. This one here, threshold potential, right? So be careful with the wording when you look at these questions. Okay, go to number 66. We have Stephen, would you like to go?
Yeah. Ion channels that are always open are called, that is C for leak channels.
C is correct. They are the leak channels, right? Because the gated channels, they need to reach a certain threshold to be activated. But the ones that are constantly open or always open are the leak channel. Next question is number 68, and we got. You guys want to answer? Raise. Otherwise, I'm not going to call on you. Irene, would you like to go?
Yeah, 68. If the sodium potassium pumps in the plasma membrane fail to function, all of the following occur except that I put down B, neuron will slowly depolarize.
Okay, so you got to be careful with this question again. So remember, what's the role of the sodium potassium pumps that we just talked about in the brain? Remember, I drew this figure here. The role of this guy.
Yeah.
What was its function? What would the
function? The function was the action potential, stimulation, transport of the cation. Yeah.
So the actual function of the sodium potassium ATPase is to throw out 3 sodium, right?
Right.
Bring back sodium cations inside the cell, right? So remember, throw away 3 Na plus, bring back plus, right?
Mm-hmm.
So then here it says this pump, right, that we just talked about, the sodium potassium pump, right? That, let's say this is your cell again, right? And this pump that we said the function was to get sodium and bring 2 potassium inside, right? It stops to function. We're working.
Okay, so if it's not working, that means intracellular concentration of potassium ions will increase.
And why is that?
Because there is no exchange. There's a failure, fails to function, to push out the ATP, pushing out the potassium.
We're going to go to number 69. Let me make sure it's visible. All right, number 69. Let's see. We got Steve goes, and then we're gonna go back to Ian or Stephen.
Number 69. If the permeability of sodium ions increases in that, let's say axon. Okay.
Axon.
For this one, I would say B, the membrane potential will hyperpolarize.
So the hyperpolarization, if that will occur, this will not under a sodium, right? It will be efflux of potassium. So hyperpolarization means it becomes more negative. It wants to reach negative 88 or negative 90 millivolts. So here, if the permeability, right, of the sodium ions increases in the axon, right, what will actually occur, you will have both inward movement of sodium ions increase and the membrane potential will depolarize. So so what I'm saying is basically the surface of the neuron, right, the permeability of those sodium ion channels or sodium ion gated channels increases. So now we have both the inward movement of sodium will increase, right? That makes sense. More sodium will rush in, and we know sodium is primarily responsible for the depolarization aspect, taking that membrane towards more positive side, right? Because the equilibrium potential for sodium is in a positive range, as opposed to potassium, we saw was in the negative range. So the correct answer 69 would be E. Yeah, inward movement of sodium, we know is going to cause depolarization to occur. All right, we're going to go next to Ian in number 70.
Which of the following is not involved in creating the resting potential of a neuron? I put C, membrane permeability for sodium ions is greater than for potassium ions.
That is correct. This is not involved in creating rest for the neuron. Everything else that you see here is, so membrane permeability for sodium ions is not greater than for potassium ions. We actually have potassium leaky channels on the surface, as you guys know, but all other choices, right, are responsible for creating the resting state of the neuron. So C, 470 is the correct choice. We're gonna go next to Andrew. Andrew for number 71.
If the potassium permeability of a resting neuron increases above the resting permeability, the effect will this have on the transmembrane potential? I put down D.
So remember, what is the primary responsible for depolarization of the membrane? Out of we have sodium, we have potassium, right? Let's just say we have calcium. Which of these is responsible for depolarization of the membrane? We just talked about it.
It's potassium, right?
The depolarization. Depolarization is taking the negative to the positive. So sodium is the primary cation that's responsible for the depolarization. So just that should be the correct answer for that, right? So the correct choice is actually B. Why is it B? Because if the potassium permeability of the resting neuron increases, and we have, so let me draw another cell here, right? And we said there is a potassium leaky channels, right, that are present on the surface. So if these channels are now more permeable, and we said that there is cells are bags of potassium in the sea of sodium, this will now leak potassium. As the potassium is escaping, potassium is a positive, right, ion. So if the positive charge is leaving the cell, it's going to make the cell more negative. So if positive charges is leaving the cell, it's going to make cells more negative. And we also saw that, right? What's the equilibrium potential for potassium? Equilibrium was negative 88. So it's going to make the N negative. So for 71, right? So if we increase the potassium permeability, those leaky channels will secrete potassium out, taking the inside of the cell more negative, right? So the membrane will become more negative. If you want to commit something to memory, the following I would commit to memory. Cells are bags of potassium in a sea of sodium. And the other important thing is sodium is the primary cation responsible for depolarization, and potassium is the primary cation responsible for repolarization. Not only is this important for your nervous tissue, get to the cardiac like this will be so important for you to learn, because all your pharmacology for your cardiac drugs is dealing with sodium, potassium, calcium, right? Channels. And you probably heard of medication channel blockers, right? Potassium channel blockers, calcium channel blockers, beta blockers, right? All those are working, right? In these cells, right? And blocking them to not allow the ion flow of these cations. So understanding the normal of the cell, right, will be very important to understand pharmacology. If you do not understand the normal, right, you would not understand if let's say I block this potassium channel. So if I don't know the normal physiology of this is, I would not understand, the function of this drug. So the best way to learn the pharmacology of these medications is to learn, right, what normally happens in the body. Right, so 71 is choice B. All right, next we're gonna go to question number 72, and after Ian, Irene, would you like to go number 72?
Yes. 72, sodium potassium ion exchange pump I put down D, move sodium, potassium opposite to the direction of their electrochemical gradient. Please tell me that's right.
That is correct.
Okay, thank you.
All right. I thought it was that explanation was productive. So then, yes, you are 100% correct.
Thank
right?
you.
Move sodium and potassium in opposite direction.
Mhm.
How much sodium it moves out and how much potassium it moves in? Do you remember?
Okay. 3 sodium out, 2 potassium. No, I said it backwards. Yeah. 3 sodium in, 2 potassium out.
Yeah. 3 potassium out.
3 sodium in, 2 potassium out.
3 sodium out. And then 2
No,
potassium.
in. No,
Yes.
no. 3 sodium go in because the sodium is outside, it's going in.
No.
And 2 of the potassium go out.
All right. Let me see if I could explain again so that this is
We
very
just
clear.
saw that a little while ago. Okay.
Irene, so we're gonna draw the cell one more time,
Okay.
right? I'm gonna say what
Okay.
happens normally, right? So we said cells, right? Cells are bags of potassium. That means there's a
Right.
lot of potassium inside the cell. Make sense?
Right. Right.
What's outside is sodium.
Sodium. Mhm.
Okay. That's why I say cells are bags of potassium in a sea of sodium. What happens is,
Sure.
right? If sodium trickles in, and we said the equilibrium potential, right, in the cell, let's say, is here, right?
Yeah.
Negative 90 millivolts.
Yeah.
Positive cat rush in. It's taking the cell towards more positive, right? So maybe it was minus 90, is 80, right? Becoming more. Now it's minus 70 millivolts. The moment it hits
Okay.
minus 70 millivolts, we have voltage gated channels. These are voltage gated. The moment this hits negative 70 millivolts, we triggered threshold potential. So this is our threshold potential. These channels open
Okay.
up.
Right.
And then we said there's a lot of sodium outside, right? So if there's a lot of sodium, sodium is rushing in. Makes sense. Sodium is a positive cation, right? So it's gonna take the resting state up. It's gonna rush. It's gonna be like that. So let me make it. This was our resting, and it's rushing up because it's becoming more. At this point, we have channels that are voltage gated. They're also on the cells, and they're gonna open. And what they're gonna this potassium
goes out.
Gonna into the surrounding cellular fluid. Make sense?
Okay. Yes.
So as the potassium is leaving the right, it's now going back to the negative state. Why? Because it's gonna to go back to repolarization, right? But before it hits that negative 88, right, the sodium channels close, right? So now after all this business that we talked about, right, what happened? We have a lot of sodium that came inside, right? A lot of sodium that came inside, potassium that left the cell.
Right.
I want to now go back to my normal resting state and also the concentration gradient inside the cell that was there to begin with. So now I have to employ these sodium potassium ATPases that are found on the surface, and they actually do this continuously. So now after all this, right, we said there was more sodium inside the cell and there was more potassium outside. So now I want to restore it. So what I got to do, I got to kick out 3 sodium, right? And I want to bring back
2 potassium.
Why do I want to do this? I want to restore the normal of and the concentration
Balance.
of these cations. Good, very good, balance.
Okay.
I want to restore balance. I'm using ATP to do it, right? So I'm going to get rid 3 out, 2 potassium in, right? So if you look at this question, right, D was they're moving in the opposite direction.
Opposite.
100% correct. But what you're actually doing is you pumping out him out, bringing to a good way to remember. Maybe this will help some of you. You see how sodium has it's 1, 2, 3, so it's Na plus, right? So there's like 2 letters and 1 plus, so it's 3 symbols. So it's 3, right?
Okay.
Potassium is 1 letter K plus, so it's 2. Right. So this way now you know there's 3 sodium because it's 1, 2, 3. Potassium 1, 2. The only thing you just got to remember what does it do is it wants to restore the natural gradient. If you remember, cells are bags of potassium in a sea of sodium, and I want to restore that normal state. So what I got to do is I got to get rid of 3 sodium out, and I'm going to bring 2 potassium in to get cells to be bags of potassium and a sea of sodium. Does that make sense?
Yeah, I said it backwards. Okay.
Okay.
Thank you.
I think this is one of the most important concepts to understand, because this will, like, as I said, right, when we deal with drugs, you need to know this. Any questions about this? Because I really want you guys to understand this. There's a really chance you will see questions of similar type on your final exam.
Get ready.
All right. So if you guys again can raise your hands, I know it's it lowered the hand. We're now at number 73. If you guys want to raise your hands, we can continue. I see Ian. Ian, would you like to go number 73?
Okay. Opening of each of the following types of channels will contribute toward a graded potential, except I put sodium leak channel, C.
For 73, the correct would be E, is inactivated voltage gated sodium channels, right? Because remember, that this is asking you for graded potential. Graded potential is basically sum. Like, remember, to get to this threshold, you either have a stimulus that's strong enough threshold, or you could have graded. Like, I will touch your finger, right? Maybe very little, you don't feel it. But if I continue applying pressure, maybe those receptors, right, will now activate. And this is basically, it's summative.
Oh, yeah, that makes sense.
Potentials are graded, right? So opening of these channels, right? And the choice here is accept, right? Inactivation of voltage gated sodium channels. So E is the choice here. All right. We got Mr. Alston. I think your name was in Zoom.
Mic on. Voltage gated channels are present C.
C is correct in the membrane that covers axons. Yeah. Why is it in the membrane of axons? Because axons propagates the signal. We talked about Schwann cells, right? That myelinate, right? They surround it, and you have the nodes of Renvier, especially, right? That increase the conduction, called saltatory conduction. But voltage gated channels are present in the membrane because they propagate the signals. Very good. Let's go with Andrew for number 7.
Blank channels are channels open or closed to respond to binding specific molecules. Chemical gated.
Chemical gated is correct, right? So they're chemically gated. Here there's there could be channels, sodium channels, right? So here the channels in response to specific molecules, they are chemically gated. That is correct. Number 76. Aaron, would you like to go 76?
Sure. Channels open or closed in response to physical distortion of the membrane surface, mechanically gated.
Mechanically graded. These are essentially your touch receptors, right? That I was talking about. So touch receptors and send the propagation of impulse on your neurons, right, to the central nervous system for interpretation. So yes, mechanically graded is correct. 77. We got Steven.
A gated channel that responds to changes in a transmembrane potential is called and that's a B, voltage gated channel.
Which is correct. Yeah, transmembrane potential, right? So they're referring to, going to, response and depolarization and repolarization. So B is the correct choice. Very good. Number 78, we'll go with, if you guys want to participate, just raise your hand. Otherwise, I'm not going to. So we go back to Ian.
78. Ions can move across the plasma membrane in all of the following ways, except diffusion directly through the plasma membrane. E.
Yes.
Good.
I think
Except,
it's because that's too large, right? To diffuse.
That is correct. The word you got to watch out for is except. I just realized what I was doing myself. So ion can move a membrane in the following ways, except. It means how can they not move? How can they not move? So the reason why there's no diffusion directly through the plasma membrane is they have to interface through the channel, right? So yes, they can in fact move through the potassium leaky channel, can move through the voltage gated channel, they can move through ATP dependent sodium potassium pumps, right? And they can move through the chemically gated channels. What they cannot do is diffuse easily. Diffusion basically like this, right? Let's just say cells are bags of potassium, so potassium and a sea of sodium, right? Can these just move across the membrane without any, right? They cannot do that. That's what diffusion is, right? Can they need specific channels to do that. And the key word here is accept. So I need to be careful when I look at these questions, right? So when they use the word accept, it means it cannot do it. So when can it not do it? It cannot do it when the diffusion is occurring through the plasma membrane. Why? Because you definitely need channels. What type of channels? Leaky channels, voltage gated channels. So Ian, you're 100% correct. 78 is E, right?
And Nick, I have a question.
Yeah.
So A, B, C, D, all ions can move, right?
Yes, that is correct.
Okay, thank you.
Like I said, right? What you need to be careful, and I want to emphasize, you read the question quickly, you don't. So you're like, ion can move across the plasma membrane, and then choices, and you select okay, passive. That makes you disregard this one. So always read the question carefully, and then if it says accept, just highlight it. So then you rephrase for yourself. You want to say, ion channels, they can move these ways, except, but out of all of these, what does not happen? And what does not happen? Fusion through the plasma membrane. And the rationale for that is you need some sort of a channel, whether leaky channel, chemically gated channel, right? Channel, some sort of a channel. So accept is the key word here. All right. We're going to go to number 79. And 7, we got Eric.
All right. Is my mic working? I'm not too sure it was working.
Sorry, what'd you say?
I just want to make sure that my mic is working. You can hear me.
Your mic is perfect.
Okay. Which is not true of voltage gated sodium channels? Put D. They have both an activation gate and an activated gate that work dependent of each other.
Yeah, D is the correct choice, which is not true. So again, right, the question is not. So out of all of these, which is not, does not make sense, right? So in voltage gated sodium channels, remember I'm going to just draw it one here, right? We were talking about, this was the activation gate, and this was the inactivation gate. And this here says I have both activation gate and an activation gate that work that work dependent of each other, right? So no, that's not correct, right? In 79, they're both activation gate and activation gate work dependent of each other, is because we have states, right, where certain state can cause closure of one and opening of the other, right? So they're not really dependent, to work together. So for example, in a state of hyperkalemia, right, in a hyperkalemia state, I can close this inactivation gate, right? So hyperkalemia was closing my inactivation gate, but affecting my activation gate, right? So they're not of each other. All right, so we're gonna go to number 81. 81, we have, if I'm gonna mispronounce your name, just correct me. It's a Bihari.
You can just call me Christina.
Oh, okay, Christina.
Yeah, okay. 81 is shift in the resting membrane potential towards zero. MV is called, it's a depolarization.
Yeah, depolarization is correct, and because we went from negative, let's say, taking it towards zero, so it becoming more positive. Do you recall which cation is responsible for taking the resting state to depolarization? Which cation is for that? So we have sodium, we have potassium, we have calcium, right? Which of these, right, is doing the depolarization? Can anyone state? Can anyone
Sodium.
say?
Sodium.
Sodium, right? Sodium is the one that's doing the depolarization. Good, right? All right. So we're up to number 82. Let me make it a bit smaller. 82. We got. We're back to Irene. Irene, would you like to go for number 82?
82, yeah. Opening of sodium channels in the axon membrane causes, I put down E, depolarization and increased positive charge inside the membrane.
Very good. E choice. I think we explained this already at least 6 or 7 times. So yes, E is the correct choice.
Thank you.
80. We're going to go to Larry. Number Larry.
I meant to put my hand down before, but
Okay. Would you like to go? Or no, you don't want to attempt this difficult?
I mean, you gotta give me a sec to think about it.
Yeah, I'm gonna give you a second. You could read the question. I'm gonna give you a second. So one hint I can give you, right? Look at the answer, right? And you see choices A, B, and E. They all start with number 4. And if you look at number, it says a graded brings an area of an excitable membrane to threshold. So that to me sounds like that might be my. So just by looking at the answer choices, I can, by looking at what 4 is, and 4 was right, bringing the area to threshold, I can right away eliminate choices C and D. So when you guys your exams, right, there's also, besides knowing the content and the material, there's also a test taking strategy. One test taking strategy. Yeah, I look at the choices. There's 3 choices that start with 4. So I'm like, what is 4? Okay, 4, it says graded depolarization brings an area to the threshold. Okay, if I wanted to confirm what is 6 and 2, 6 is sodium activation occur, 2 is voltage gated, right? So based on that, I know those first steps. So that eliminates C and D. So I know 4 is my number 1. So then I gotta see, right, what's number 6 versus 2. So 6 has sodium channels.
Elimination of 2, E2 would be.
And then 2 is voltage gated potassium. So potassium channels are not the first open, right? So 6 doesn't seem to be the 2 channels doesn't seem to be correct. So anything that says 2, I can remove. So now we know that 4 and 6 are occurring, right? 4 means graded potential occurs, area to threshold. Once threshold is reached, the first thing I know is this opening of the sodium channels. So channels activation occurs. So I know 6 is definitely a number 2. Then we got number 7. So both of them have 7. 7 being sodium open, ions enter the cell, and depolarization occur. So far, both A and B look good. Then their main distinction is going to occur here between 1 and 3. So what happens after sodium, right? So 1, sodium become inactivated, or number 3, sodium channels regain their normal properties. So for sodium channels to regain their normal property, cell must repolarize. That only occurs after potassium leaves. So 3 cannot be our choice. So based on that, the correct choice is B, right? So that's how I would approach these types of questions. First, look, and then eliminate based on the information you're given. So for number 84, the choice is B. Why? Because first step, I looked, right. We all know we need to have the threshold to be reached. The moment threshold is reached, first thing to open is sodium. Then sodium channels open, sodium comes inside, right? And for the to reach state or repolarize, then we have to have the potassium. So potassium is never going to be the first thing in terms of voltage gated. So that's how I would approach. Any questions on number 84? We're gonna go to number 85. I see Louisa, you have your hand up.
Yes, I guess. 85.
85, yes.
Okay, so which type of membrane channels are found in exons? I will go with A.
Is that so? All your choices, all your answer choices, because if
It's
this
E.
is the reason why it's E is right because choice E is inclusive of these two,
Yes.
right? So and this says which channels are found in exons, and remember, right? What does exons membrane do? It has to depolarize and repolarize. So depolarization is done by sodium, repolarization is done by potassium, right? So the reason why E is the best, I'm not saying A is incorrect or B is incorrect,
get it, but it's
but
incomplete.
yeah, but E is the best choice. Why? Because this membrane has both of those channels. So for number 85, E would be the best choice. So always look at, if a question is inclusive of this, think about it before, right? So that's another strategy. All right, number 99, I'm going to go to Eric.
The period during which an excitable membrane can respond again, but only if the stimulus is greater than the threshold stimulus is the put A.
So remember, in refractory period, no stimulus can trigger activate. Once you learn EKGs, you're going to learn there is absolute refractory period and there's relative refractory period. So when it's absolute refractory, meaning refractory period, no stimulus, it doesn't matter how big it is, cause the excitable membrane to depolarize. But stay here. So in 99 says during which period, right? If your stimulus is strong enough, right? It's going to cause the threshold stimulus. So here for 99, the correct choice is C. Why? Because in a relative period, right? It's still right a high amount of stimulus can cause it. The analogy I can give you is that let's say you flush your toilet, right? If you flush it right doing it, it's not going to flush again. Why? Because the water is still filling up. But there was a period of time where before it fully filled reservoir, if you pull it again, it can start to again. So the refractory period being when you cannot flush again, and relative refractory period being when you could just wait a little bit and then you do it and it's gonna a little bit. So that's the difference. A strong enough stimulus can cause them to depolarize. So remember that. It's gonna come back once you learn EKGs and the cardiac chapter.
All right, thank you.
Yeah. Number 107, I think that's the last one for this one in particular. We're gonna go to Ian.
Cholinergic synapses release the neurotransmitter D-acetylcholine.
Very good. So that's primarily in neuronal cell, right? Acetylcholine. So yeah, and cholinergic synapses, that's what they release. Very good. So this is the autonomic nervous system. Also very important in pharmacology, right? We're going to continue. I see Louisa, you have your hand up for number 4 here.
Sure. All right, so the preganglionic fibers leave the CNS and then synapse, is that how you say it?
Correct. Synapse.
Synapse on, I will go with A.
So preganglionic, right? They are going to synapse initially, right, to the ganglionic neurons, and then the ganglionic neurons, right, will then go to the motor end plate. So pre is before, right? Before pre, and then you're going to go to the ganglion itself. So preganglionic is going to lead to ganglion neurons. So for number 4, the choice is We're gonna go number 8. We have Christina. Would you like to do number 8?
Sure. The sympathetic division of the ANS is also known as which of the following? D, thoracolumbar division.
Yeah, that is correct. Remember, I was showing you diagrams. So let me go up here. Right, this was our division of the sympathetic nervous. See how they all stem from your spinal cord, right? So that's why they are also called the thoracolumbar, right? As opposed to the, right, our sympathetic division, right? But predominantly they are here on the sacrum, right, and the midbrain. So this is the, in this regard. So for for choice 8D is correct. Very good. We're gonna go with number. We have we're up to Irene, 13.
Yeah, 13. The blank division of the autonomic nervous system is known as the rest and digest division. B, parasympathetic.
Very good. B, and very good. Next is Larry. Larry, you're up for 16.
Specialized ganglionic sympathetic neurons that release hormones into the bloodstreams are found within E.
E is correct. Adrenal glands, right? And what do they release?
I'm sorry, what?
And what hormone? The sympathetic neurons, right? E is the correct adrenal glands, but what hormone do they release?
Epi.
Epi is correct. Epinephrine, right? Epinephrine is what's the sympathetic system, right? And adrenal glands sit atop of your kidneys. Epinephrine is correct. Number 31, we are continuing. We are going to go back to, Christina, would you like to go?
Yeah, sure. What type of neuron of the parasystematic division exists in the brainstem? Is it B?
B, yeah, initially you have the pre that's arising. So B is the correct choice. Very good. Number 52, to go with Lisa. I see you have your hand up. Okay. You are, if you don't like to go, we're gonna go back to Ian.
So number 52?
Yeah.
Neurons that use neuroepinephrine as a transmitter are called B, adrenergic.
Adrenergic is correct, right? Yeah, no, is adrenergic from another adrenaline, right? That's why they call them adrenergic. So B is correct. 53, we're gonna go with Eric.
Hello?
Yeah, go ahead.
Stimulation of A1 adrenergic receptors by norepinephrine results in put that E.
Yeah, increased membrane permeability. So for stimulation of alpha 1, right, by norepi will actually release calcium. Remember, what does stimulation of alpha receptor do? Anyone recall? So if this was my heart and this was my aorta and these were my arterioles, right? And for 1 receptors here, so the alpha 1 and norepi binds here. What is going to do to these vessels?
Wouldn't it cause
Go ahead, Christine.
vasoconstriction?
Vasoconstriction is correct. So it's going to cause vasoconstriction. on these alpha 1 receptors, and the way it does it, right, it's the release of calcium that will essentially cause the intracellular signaling, and then the final pathway will be contraction of the small muscles, right, arterioles. So 53 is the correct choice. Okay, we're gonna go with Helmi with number 54.
Stimulation of the beta receptor on the heart cell does not result in stimulation of the beta receptor on the heart muscle cell does not result in formation of cyclic AMP, increase heart rate, not increase force of contraction. Increase heart rate B.
Okay, so that you got to be careful, right? So you don't make this mistake. You know, I got to look at the question. That's why I wrote not. This question says, when you stimulate beta receptors, which of these will not happen? So let's go one by one from right? So we said the heart, right? This is the heart. Heart has beta 1 receptors. And then if we have epi, right? So stimulation of beta 1 is usually epi comes in or norepi and is going to stimulate. So we know when beta 1 receptors are stimulated by epi, will you have increased heart rate? So if I have coming through the blood or norepi coming in, right, on beta 1 receptors, would I have increased heart rate or no?
No, will be increase the contractility of the heart.
But we'll get to that. But will my heart rate go up? Like imagine you have a dog that's chasing you. It's about to bite you, and you have epinephrine secretion. Is your heart rate going up or not?
You can increase heart rate, of course.
Yeah. So of course, increase heart rate, right? It makes sense. Will you have increased force of contraction? Absolutely, because beta 1 will do that to you. The other you guys have not learned, right, specifically, but these are beta 1 receptors. They are G protein coupled, or they called serpentine receptors. They basically like a snake that they pass through the transmembrane. They usually also call them 7-pass receptors because they have 1, 2, 3, 4, 5, 6, 7 passes through the membrane. So, and what they do is they cause cyclic AMP, right? So they have formation of cyclic AMP, and they also metabolism, right? Because if your heart rate is beating faster, right, they're going to consume more oxygen. So metabolism of the heart is going to increase, right? What it does not do, right? Remember, I put not. It does not inactivate. It actually activates G protein coupled receptors. So for 54, which of these does not happen? It's inactivation of G protein coupled receptors. So E does not occur. Everything else does. All right. We are number 5. Let's go to
You said Irene?
55.
Okay. Nicotinic receptors. C. Open chemically gated sodium ion channels.
Okay, very good. Yeah, nicotinic receptors, open chemically gated sodium channels. Nicotinic receptors bind acetylcholine bind to that receptor, opens up the channel, and sodium is coming in during muscle contraction. All right, 56. We got, unless you guys raise your hands, I'm going to call on their hands up. So I'm going to go back with Ian.
Muscarinic receptors A are normally activated by acetylcholine. Very
good. Acetylcholine is correct. And the other one, right, being acetylcholine, this transmitter activates muscarinic and also nicotinic. Right, so remember that acetylcholine, nicotinic, muscarinic. All right, now this is not yet pharmacology, but this is kind of gets you in the mindset of starting to think about drugs. We have Syed number 6.
Drugs known as beta blockers may be useful for treating D, excessive heart rate.
So elaborate a little bit on it. Why is they're good for treating excessive heart?
Because the beta 1 receptor is on the heart.
Yep.
And I guess it's being excessively stimulated, so your heart rate will be faster than normal. So the
Yeah.
beta blocker will block those receptors, so it slows down your heart rate.
Very good, right? So if your heart rate is beating very fast, I give you a beta blocker. I block these beta receptors, right? So the epi or norepi cannot bind and stimulate more beta 1, and so the heart rate will slow down. Beta block medications given in cases of tachyarrhythmias or cardias, right? So if you have fast heart rate, down. Why? Because I want to make sure your preload is not going down. So yes, 60 is correct answer is D. All right. We have Andrew.
Mary accidentally ate poisonous mushrooms that contain muscarine.
Muscarine, right? We just remember to give you a little. We just talked about, right, muscarinic receptors. Remember, we just talked about this guy here. So muscarine on the mushrooms will activate muscarinic, to give you a little hint. And the question, again, be careful. It says which of these does not happen.
D, reduction of the heart rate.
So think about it a little carefully, right? What does well, let me ask you again. What does acetylcholine part of fight or flight or rest?
Oh, it's rest.
It's rest and digest, right? So if acetyl is rest and digest, said that some Mary ate mushroom in muscarine. Muscarine is going to work on muscarinic receptor, mimic acetylcholine, right? And another way maybe you could remember, right? You guys the sludgium. Sludgium is the mnemonic you use when there's excessive acetylcholine, right, stimulation, or excessive stimulation, right? So you have salivation, lacrimation, urination, defecation, gastrointestinal distress, emesis, meiosis. So we got to look at this, right? We basically, this question saying all of this will happen except, will you have constriction of the pupils? Yes, because you have meiosis. This will definitely happen. Constriction of the respiratory passages? Yes, right? This will, in fact, right, have a person having respiratory distress, especially like if they chlorine gas, something like this. Diarrhea, we just talked about. Gastrointestinal distress, right? Will they have reduction in the heart rate? Yeah, they will have reduction in the heart rate because parasympathetic rest and digest, right? So you do, in fact, see that you're going to have a reduction in heart rate. What does not happen is feeling of euphoria and increased energy. This does not happen. All right, we're going to go to number 62. And for number 62, I see, if you guys want to participate, again, raise your hands. I'm going to go with Irene for number 62.
Okay, 62 it is. An inhaler used to treat airway constriction in asthma or allergy might contain a drug that B, activates beta-2 adrenergic receptors.
Well, is that I'm not saying the choice is incorrect, but is there a choice that is better?
D looks good too.
Okay, you could have D, but most of these drugs, they're more selective beta 2. Why? Because if I do beta 1, I'm going to increase my heart rate, and I don't really want to do that, right? So a lot of these buterol, or they make compositions that are more selective. So
E as in Edward.
E is good, right? E as in Edward is good. Why? Because E is inclusive beta 2, which one you said earlier, beta 2. And also, you can block the muscarinic, and muscarinic is the parasympathetic division, right? When you start your protocols, right?
Yeah.
There is a combi med we give. We give a combi treatment. And you want to know for asthma, what is the combi medication we give?
Protropium.
Protropium with albuterol, right? We put it together in a nebulizer.
And
so the way albuterol works, it's a beta 2, right, receptor agonist. So it will do a bronchodilation, right? But ipratropium is muscarinic cholinergic receptor, right? Is going to block the parasympathetic side of it. So that's why we basically
Dry them up.
we hit him with combination therapy, right? The parasympathetic and activate the sympathetic. So this is what it will do, right? And basically says an inhaler is used, right? What the drug may contain. So if you use a combi vent, this is what it's going to do, right?
Okay, thank you. Good.
63 to go now. Help go. 63.
A certain drug decreases heart rate by blocking a receptor on cardiac pacemaker cells. This is drug probably binding to beta 1 E, beta 1 adrenergic.
Yeah, E is one, right? So if we have a drug that reduces heart rate, and it does it by blocking a receptor on the pacemaker cells, so it's probably beta 1 is blocking, right? So this is correct. Adrenergic receptor. 63 is correct. Number 67, let's go with Syed.
Ganglionic neurons in the adrenal gland. I think it's C.
C, release epi, right?
Yeah.
So the best way to look at adrenal gland top of the kidneys, major function of the adrenal gland. The major function of the adrenal gland, right, is so that's how you should be approaching these questions. All right, now we're back to Ian for 70.
In general, autonomic tone of peripheral blood vessels increases when a sympathetic stimulation is increased.
Yeah. Can you tell me the neurotransmitter and the receptor?
Let's see. So we're increasing the stimulation in the vein. So that would be constrictor? Would that be alpha 1?
Alpha 1, and what's the transmitter? Alpha 1 is correct.
I would say it's acetylcholine.
You got to be careful.
No. I'm sorry. Yeah. Let's see. I'm thinking it's epinephrine.
Right. So if you to change your thing, if you said the preganglionic would be choline and then postganglionic would be epi, that would be even more precise, right? But the postganglionic, the one that actually synapses to the alpha 1, would be epi or norepi. Right? If you said preganglionic is acetylcholine, you would have been correct, but you have to be careful, in terms of where it's coming in. All right, number 74, we are going to go with Aaron. Last question.
Parasympathetic functions include all the following except constriction of the pupils.
So be careful, right? Except means not. So think about function include all except, right? So remember your sludgeum. So let's go one by one, right? Will it reduce the heart rate? Rest and digest. Yes, it will, right? Will it constrict the pupils? So meiosis is constriction of the pupils. Constrict the pupil. Dilate the airway. Which system dilates the airway? Sympathetic or sympathetic? We just talked about beta 2 stimulation.
Sympathetic.
Yeah. So based on this is a good choice, right? For now, let me go down. Stimulation of urination. Yeah, it does. Sludgeum. Defecation. Yes, we have gastrointestinal distress. So it will definitely stimulate defecation. So out of all of these, which it do is C. It will not dilate the airways, and the system that does it is the sympathetic system with beta 2 stimulation, right? Drugs such as albuterol will cause dilation, right? Any questions? Any questions we've done so far, or anything in this chapter?
Yes, what was the answer for question number 31?
31. 31 was B.
Thank you.
Okay. Any other questions?
I have a question. It may sound silly, but so sludge for the parasympathetic system, right? But how come when someone's surprised, they might poop or urinate themselves?
Unsurprised?
Yeah, like scared or surprised. You would think the sympathetic system would kick in and
Because
yeah.
you know, so what you gotta understand is like in your body at that moment, your both systems are functional. So you have sympathetic and the parasympathetic are functional at the same time. And what determines you know, what predominate is activation of one or the. So maybe their response is in that setting is they have heightened activation, right? And if they have heightened parasympathetic activation, this is what occur. That's not a normal, because say, you know, I put you and there's, you know, a dog that I release to bite you, right? Usually the normal response activate your sympathetic. You're going to feel your heart is beating faster. You start to breathe faster. And why? Because you want your muscles to work and run, right? These will open up, dilate. It's called mydriasis, sympathetic stimulation. And usually at that time, right, your sphincters will constrict. Your sphincters are also on the controlled by your sympathetic system. So let me go back to here. Right. So you see your sphincters, the urinary, right, and your motility of the GI tract, right? You don't want that activating. Why? Because if that activates, peeing, right, and passing stool, if I'm trying to run away, right? But on the parasympathetic, right, yeah, that's one to for most of us, right? Unless you have some sort of abnormality, when you have the stress system activated, usually your sphincters close up and more supply is going towards your muscles, heart, right, lungs, eyes, so you can see and run away or deal with the threat. So no, that's usually not a common thing, right? But it does. I guess a person has a particular is heightened parasympathetic tone, so that could occur. The other thing that may happen is if someone took a drug to block the sympathetic system. I can give you an example, right? You may respond to a call. You will see, let's say, somebody who is on beta blockers, right? And let's say they fell. They fell and they're bleeding and they're going into hypovolemic shock. You don't see the heightened heart rate. So you're questioning, like, why don't I see the elevated heart rate? Sympathetic system is activated. They should have it, but they don't. And the reason why is that they are on a beta blocker that's not allowing that to occur. Same thing in alpha blockers. You may not see that profound vasoconstriction. So maybe they took some medication to block, or they on some sort of medication that blocks the sympathetic division. But that's not a normal occurrence. Hopefully that answers your question.
Okay.
Mm-hmm.